Zang, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross. Chapter 5, Patterns of Disease. Apparent Contradictions. The pattern of signs manifested by a patient in the clinic can often seem complex, confusing, and contradictory. Signs of heat may be mixed with signs of cold. There may be signs of both deficient yin and deficient yang, and signs of interior and of deficiency may coexist with signs of exterior and of excess. Internal and external. As discussed in Chapter 4, both internal and external causes may contribute to a pattern of disharmony, as in the case of internal and external cold interacting with deficient shen-yang, internal and external heat interacting with deficient shen-yin, and internal and external damp interacting with deficient pi-qi. As external factors invade the body, they may change their nature. For example, cold wind may become heat subsequent to invasion, and they may progress deeper into the body and become termed internal rather than external, or as well as external. These changes are described in the classification of the 6 stages: disease due to cold, and the classification of Wei, Qi, Yin, Xue, and Sanjiao, diseases due to heat. Discussion of these 3 major classifications is outside the scope of this book. Deficiency and excess. A patient may have signs of overall deficiency of Qi and Xue. In addition, they may have signs of local excess due to local stagnation and accumulation of Qi, Xue, or Jingye in a particular area of the body, perhaps due to trauma or local invasion of cold and damp. Also, there may be apparent signs of excess with genuine underlying deficiency, as in the pattern of deficient yin or deficient heat. Alternatively, there may be patterns of excess in one Zang existing simultaneously with pattern of deficiency in other Zang. For example, there may be deficiency of Pi leading to production of phlegm, linked with the excess pattern of retention of phlegm in Fei. Besides being woven together, patterns of excess and deficiency may transform into one another. For example, chronic asthma of the deficient type, that is, involving deficient Qi of Shen and Fei, predisposes the body to invasion by external cold. Such invasion may lead to an acute attack of asthma of the excess type. This temporary excess pattern usually later subsides into asthma of the deficiency type. Hence, there is a recurring pattern of underlying chronic internal deficiency with periodic acute crisis of the external excess type. Cold and heat, yin and yang. The simultaneous occurrence of signs of deficient yin and deficient yang is discussed in Chapter 3 on page 22 and in Case History 7 on page 244. Qualification of the classifications of the 8 principles. So far, in this discussion, the signs of an individual's pattern of disharmony have been classified in terms of yin-yang, the 8 principles, and combinations of the pattern of the 8 principles with each other. However, this classification of 8 principles is usually qualified in terms of the pattern of disharmony of other categories: disease factors, substances, Jinluo, and Zangfu. Examples of such qualification of the classification of the 8 principles are given in Table 5.7. Table 5.7. Qualification of the classification of the 8 principles. Qualification of disease factors. The examples are internal damp, external wind cold. Qualification of substances. The examples are deficient Jing, heat in Xue. Qualification of Jingluo. The examples are invasion of Ganjingluo by external cold. Qualification of Zangfu. The examples are deficient Shengyin, hyperactive Xinfire. For example, there might be signs of internal disharmony in terms of the 8 principles classification. Chronic pattern with gradual onset, changes in urine and stool, and thick tongue coat. However, using the categories of the disease factor, the classification of the patient's pattern in terms of the 8 principles can be qualified or extended. Feelings of heaviness and fullness in head and chest, slippery pulse, and greasy tongue coat indicate the pernicious influence damp. The classification of the patient's pattern now becomes internal damp. Similarly, a pattern which is of deficiency in terms of the 8 principles, patient weak with thin pulse and thin tongue coat, may be qualified in terms of the patterns of disharmony of the substances. For example, there may be premature baldness, loss of teeth, and senility, indicating a disharmony of Jing. The overall classification of the patient's pattern is therefore deficient Jing. The patient may also be classified in terms of the patterns of other systems. For example, the 6 divisions, Wei Qi Yin Xie, Wei Qi Yin Xie, Sanjiao, the 8 extra channels, the 5 phases, and the 10 heavenly stems, and the 12 earthy branches. However, in clinical practice, the fundamental systems for the classification of the patient's patterns of disharmony are yin-yang, 8 principles, disease factors, substances, Jingluo, and Zangfu. Common disease patterns. Finally, TCM recognizes various common disease patterns which may involve some or all of the 5 main categories of disharmony listed above. The common disease patterns listed in some modern Chinese texts are a curious mixture of presenting signs, Western syndromes or diseases, and Chinese disease patterns. For example, Table 5.8, Components of Common Disease Patterns. Component of presenting sign. The examples are insomnia, oedema, and headache. Component of Western syndrome or disease. Examples are malaria, arthritis, hyperthyroidism. Component of Chinese disease pattern. The examples are Wei pattern, Bi pattern, Xiao Chuan. All 3 categories have been included under the phrase common disease patterns, since they overlap and often no clear distinction exists. The confusion arises from the use of Western terms with their specific Western medical connotations as approximations for Chinese terms, which may have rather different meanings. For example, the Western term asthma is used as a translation for the Chinese pattern Xiao Chuan, but the 2 concepts are different, based on very different theories of health and disease. Also, some Western syndromes have no equivalent in TCM. For example, cholecystitis and cholelithiasis. The signs of these Western syndromes are included in the Chinese patterns which approximate to jaundice, hypochondriac, hypochondriac pain, and some forms of gastric pain. Furthermore, one Western syndrome may include a variety of Chinese patterns. For example, hyperthyroidism may include up to 6 different Chinese patterns. Alternatively, one Chinese pattern may cover a number of Western syndromes. For example, hyperactive gunfire is involved in some forms of essential hypertension, glaucoma, menorrhagia, and emotional disturbances. Summary. This chapter dealt with the classification of patterns of disharmony in traditional Chinese medicine. The 8 principles classification was discussed in some detail, since it is the initial stage of differential diagnosis, and since the diagnostic method of tongue and pulse analysis are described in terms of the 8 principles. Also, the pathologies and patterns of disharmony of the Zangfu are in terms of the 8 principles, the disease factors and substances. This ends part 1 of this book. Part 2 is concerned with the Zangfu, beginning with chapter 6, which is a brief overview.